Canada!
Pressing the off button, going halvesies, and villain kebabs, oh my gosh. In honor of the new Deadpool and Wolverine movie coming out, today we are breaking down and reacting to all the fantastical medical scenes and anti-hero injuries from Deadpool.
¿Dónde está la biblioteca?
Let's dive right in. Nice.
That does it!
Oh!
Canada!
Oh my gosh, that's definitely how majority of the patients I see that come to the emergency department with a broken hand due to punching something probably feel. Typically what ends up happening is a classic boxer's fracture. Not an injury like Deadpool here, but you typically see a fracture of the metacarpal.
That's not good.
And you can see like his wrist is just floppy everywhere. You can get a wrist fracture with different types of trauma due to pushing your hand out to try to brace yourself versus coming across and hitting something.
Please. Shot.
Oh!
Your poor wife.
Typically, we don't see bilateral hand fractures like that. You could, but then you get worried that outside of hitting somebody who's made of steel, why is somebody breaking their hands so easily? There's something called osteogenesis imperfecta.
Osteogenesis imperfecta.
Where somebody can get very easy fractures.
You really should stop.
All the dinosaurs feared the T-Rex.
Oh my gosh. You see just these two lumps like right here in the wrist. You know, could that be a depiction of the distal ends of your radius or your ulnar? Could be, but you also have a ton of wrist bones, as well as, again, all of the metacarpals. Oh!
I promise this gets worse for you, big boy!
Oh my gosh, look how badly displaced that ankle is. So you're snapping it. You're gonna have what's called a trimalleolar fracture. Fractures of 3 different areas of the ankle, also relating to ligament injuries, tendon injuries, and possibly a dislocation.
You ever hear of the one-legged man in the kicking contest?
Do you have off switch?
Yeah, it's right next to the prostate. Or is that the on switch?
Oh. Talk about like the idea of like spidering the windshield. You worry about obviously some whiplash injury. Ends up most of the time with cervical strain of the muscles of the neck. Definitely if you're having any pain to a specific area of a bone, it needs to have imaging to make sure you don't have fractures.
You ever see 127 Hours?
Oh my gosh, so a movie referencing 127 Hours is where the individual gets their arm stuck in a crevice and ends up having to cut off his own arm. Oh my gosh. I can tell you, for one, because I've done amputations before, cutting through all that tissue is not easy. Yes, it is messy. We do it very systematically where when you cut through the tissue, anytime you see a small blood vessel, it's going to get cauterized. If you see a little bit bigger blood vessel, you actually need to tie it off before you cut it.
Are you there, God? It's me, Margaret.
Oh! When it comes to cutting the bone, you use a saw to cut it. You wouldn't necessarily cut it straight across because you need tissue to be wrapping around the end of the bone, otherwise you have exposed bone.
I'm gonna rip you in half now.
That is such a juggernaut thing to say.
Oh! Oh! Juggernaut. I remember as a kid, I used to have a Juggernaut like action figure.
Juggernaut!
Ripping a human in half. Obviously, we know this is very far-fetched. We just see a ton of blood pouring out. You're ripping through the major blood vessels that run through the pelvis abdomen there, which would include the inferior vena cava as well as the abdominal aorta.
Oh my God, I can't feel my legs! I can't feel... Oh no, they're right here.
Could he potentially feel his legs? Maybe, may be able to feel the pain, or he might feel obviously nothing. Most of the time in the acute injury, you feel nothing, which is very, very scary. But then later, after the damage is set, the swelling is gone, sometimes people can have phantom limb syndrome.
Maximum effort.
Oh, yes.
Yes.
Normal person, not Deadpool, that would cause significant injury, breaking through glass, but you're still causing trauma to your feet and your spinal column. Oh, massive road rash, eating away the tissue. A lot of times what ends up happening, you get deeper than the blood vessels and you're gonna need a skin graft to have this area repaired. Ooh, a lighter. Oh, anybody's car still have one of these lighters? I don't think mine does anymore. Burn the guy's forehead. Hopefully that burn doesn't go all the way through. That needs to have repair to where you have to have a skin graft on your forehead. Typically deep 2nd degree burns and 3rd degree burns will require that. Shot through the right forearm and all the way through and through. If the bone is injured, it needs to be taken to the operating room and washed out. You would get significant concern for osteomyelitis, which is the infection of the bone. Oh! Posterior, the exit wounds through the skulls have a significant amount more of trauma, and that just has to do with the force as it's going through and the energy that it takes with it. 1 bullet versus like 50 just depends on the areas that you're getting hit. Oh, well, you guys know weapon in the body. What do? Of course, you do not pull it out. This also reminds me, for you, my Dr. ER audience, I have a special discount code for my Life Happens supplements. Don't pull it out, 30. Oh, flying into a metal post like that. Most people will end up getting soft tissue injury. A big bruise, ecchymosis. Ecchymosis. Basically meaning pop blood vessels underneath the tissue. Typically purple, blue, and then over time will turn like a greenish yellow. You definitely want to double check and make sure that there's no fractures. Ow. Is that knife in his head? Oh my gosh. Holy crap. Does this happen? Rarely. I've seen many people come in with the attempt of a knife to their head. Typically the skull is resilient enough that it bounces off, as well as spherical, so it's hard to actually have that point go in. Oh! When somebody falls like this, gets caught, you worry about whiplash injury.
I think I got whiplash.
Spinal cord injuries because of being pulled, as well as any groin discomforts because the parachute gets caught and pulls up on the groin.
Stage left, you idiot!
Oh my gosh. Typically, our blood as human beings is red. Despite what people say out there in the universe where they say our blood is blue, it is not blue. It might look blue through the skin, but no, it has nothing to do with when the blood hits oxygen. Does it change color because there's oxygen in your blood? So no, the blood is red.
Vanisher.
Maybe the wind
can't Oh my gosh. Somebody gets electrocuted, you basically check, for pulses, look, listen, feel, start CPR, get an AED, an external automated defibrillator, get the individual to the hospital.
X-Force! X-Force.
Oh no, I know what's gonna happen. Oh no. Typically the injury that we see relating to heavy machinery is a hand, usually, or a limb getting stuck at work or something and it gets tore off. Most of the time you can't reattach it and it's just an amputation at that point, unfortunately.
Peter, we're X-Force.
Whoa. Oh my gosh. What the heck? There are some chemicals out there that can definitely get on your tissue and cause significant amount of trauma or injury. Typically, if anybody comes in with like a chemical exposure, we need to know what the chemical is, and then we'll actually call poison control ourselves. In the United States, it's 1-800-222-1222. Keep it coming. I'm very entertained. I enjoyed Deadpool. And of course, there's over-the-top injuries in this show, but a lot of relevant things that I see on a daily basis in the emergency department. Have you guys seen Deadpool 1 or 2? Let me know in the comments, and let me know who's excited for the next Deadpool to come out. If you guys enjoyed this, definitely check out this playlist right here. And as always, do me a favor, subscribe, turn your bell notifications on, and hit that like button. Thank you so much for watching, and stay healthy, my friends.